Welcome back to the Morning Blend. June is Men's Health Month. It's an important time to raise awareness of how men can treat, if not prevent, serious health issues.
That's right. Here to discuss how men can take control of their health is Healthcare Partners Nevada primary care physician. That's Dr. Justin Maxwell, my doctor. Hello, sir.
Hello, welcome.
Good to see you again.
So what are some of the most important things that males should be aware of when it comes to managing our health?
First thing, they need to actually go to the doctor. It's not uncommon that men will actually come for the first time in their 40s or their 50s for preventative medicine because their wives are saying, all right, you know, honey, it's time for you to kind of get in and see the doctor. And I'm sure that's what your wife said about you. Yeah. So we give her credit for that. But it's important to know that the CDC states the average longevity or lifespan for a man in the United States is about 76 years. For women, it's about 81, 82. So they're living about 5 years longer. They're probably going to the doctor a lot sooner. And that's why it's very important that males are starting in their 20s so we can talk about genetic factors, family history. Give you an example. Some patients, they will say all the males on their side of the family have died of early cardiac disease in their 40s and their 50s. That is going to change how we approach that person. That if we're going to be more diligent in genetic testing and things like that.
So when you go to the doctor in your 20s and 30s, you can look for flags and do testing and things like that. That'll have you down the road be in much better condition than, say, if you started in your 40s.
Correct. We're looking for signs of diabetes. We're checking blood pressures. We're looking at weight, BMI, which is the body mass index, to make sure that you're at the appropriate weight for your height.
Yeah. Heart disease is obviously a big issue. It's not just men, though. It's men and women.
Correct. So heart disease is actually the #1 cause of death for both men and women in the United States. And about 50% of the people who actually die from sudden cardiac death have no symptoms prior.
Wow.
So that is why it's very important that people are getting in to see their doctor earlier so we can screen.
So what things can we do right now to improve our overall health?
First thing, aside from getting in to see the doctor, is if you smoke, quit smoking. Smoking is one of the worst things that you can actually do to your body. Not only does it increase your chances of all types of cancers, but it damages your blood vessels, predisposing you to an increased risk of heart disease, stroke. Make sure you're maintaining an appropriate blood pressure as well as weight, and stress. Stress is a silent killer. Get into a room, meditate for 15 or 20 minutes or so, detach from life, get rid of your electronics, no distractions whatsoever, as well as sleep. Minimum of 8 hours of sleep a night. Sleep is very important for your immune function as well as for anti-aging and other factors.
So some people try to get away with 4 or 5 hours. That's not cut it.
That's too low.
How often should men be planning on seeing the doctor? I had a friend of mine on Facebook said he went to the doctor for the first time in 15 years.
Oh, man.
Not what we should be doing.
No, you should start in your early 20s. If you're a healthy 20, 30, 40, even 50-year-old male, you don't have any medical problems, once a year is sufficient. But if you're someone who has, say, type 2 diabetes or high blood pressure, you're going to want to follow up with your doctor every 3 to 6 months, depending on how well controlled you are.
And it's cheaper to treat a disease in its early stages than when it's gone way beyond something.
Absolutely. Our goal is to get people in early, screen them, and treat them so we don't see the surprises when they get into their 60s or their 70s or their 80s, and so they can live long, healthy lives.
Even cheaper than that would just be maybe not getting the disease in the first place, which you can prevent a lot of this stuff. I know heart disease is preventable if you just not, if you're eating right.
Absolutely.
The total care approach, we've talked about the total care model on the show before, Healthcare Partners. For those who don't know, explain what the total care model is and how it benefits us.
Total care model is a unique model with Healthcare Partners where we have primary care physicians, we have our specialists, we have case managers, we have nurses that all work diligently to coordinate high-quality healthcare here in Southern Nevada. I like to think of it as a VIP service of medicine without having to pay the high costs that you see with boutique medicines, things like that.
And where do you practice out of?
I'm on Fort Apache in Tropicana.
And how many Healthcare Partners doctors are there here in the Valley?
I think there's roughly 200 to 300 primary care physicians.
So you can go see a specialist, a GP, you can get referred if you don't know where to start.
Absolutely. First go to your general practitioner, and then we guide where we want the patients to go see if it's a specialist.
And that's the beauty of having the total care model, though, and all being on the same
Absolutely. It's
network. You don't have to fill out the same form at every place.
Exactly.
You go.
Think of it as like everything is under the same umbrella, so you're reducing the chance of redundancy of tests, CAT scans, MRIs. The communication process is what's key.
If heart disease runs in your family and your father died of it and your grandfather died of it, are your chances much higher of getting it?
It is much higher, and that's why you want to make sure that you are screening appropriately certain cholesterol panels. There are cholesterol panels, VAT profiles that actually look at your genetics to see if you are predisposed, homocysteine levels. There are other markers that we don't normally generally do for people who don't have that risk that we can gear that visit for.
Yeah.
Awesome. Well, if you have any questions, we'll make sure to give you a call.
All right.
Thank you.
Thank you so much. Men, it's time to finally take control of your health. Go to the doctor for the first time in 15 years.
Yeah.
Healthcare Partners Nevada has physicians and specialists throughout the Las Vegas Valley. To find an office nearest you, visit hcpnv.com. They're also on Facebook and Twitter.
Your doctor